A viewer named Desmond left a question under one of my posts online this week. It's a good question. It's an actual question, which on the internet is rare enough to be worth stopping for these days. He saw this sign at Nancy Pelosi's endorsement of Wesley Bell, and he asked, when did health care start becoming a human right? He says he's just trying to track that down historically. All right, I could read you the Hippocratic Oath. I could read you the Declaration of Independence and do 4 minutes on life, liberty, and the pursuit of happiness. And maybe then I could even tell you what the founders really meant, which is a thing people say on TV when they're about to tell you what they really meant. I'm not going to do that. Here's the actual record. It's short, and nobody really ever reads it. The paper trail. 1944, Franklin Roosevelt, Second Bill of Rights, the right to adequate medical care. 1946, the World Health Organization's founding charter. 1948, the Universal Declaration of Human Rights, Article 25. 1966, the International Covenant, Article 12. The U.S. signed that one in 1977 and has never ratified it, which is its own answer to your question in a way. So that's the history, at least the early part, the 1940s. That's when the phrase enters into the law books, written by people who had just finished watching what a century looks like when a society decides that some lives count less than others. But Desmond, I also read your profile. You describe yourself as a Christ-loving, God-fearing Christian. I'm not going to pretend that's not the more interesting conversation, so let's have that one. Because the paper trail on that side is about 3,000 years longer. You remember the Good Samaritan. Guy finds a stranger half dead in a ditch, binds the wounds up, puts him on his own animal, carries him to an inn, pays the innkeeper that 2 pence, and then, this is the part I want you to sit with, tells the innkeeper, whatever else he runs up, I'll cover it when I come back. Just put it on my tab. That's not charity. That's an open-ended third-party payment guarantee for a man he'd never met before. I went back through, scouring, looking for the means test in there. Couldn't find one. There's no verse where he checks whether the guy's in a ditch was in network. There's also Leviticus 13, priest running a mandatory diagnostic and quarantine code. That's public health administered by the state religious authority. Deuteronomy 23, camp sanitation by decree. Exodus 21, you injure somebody, you pay for his healing and the time he lost. Third-party liability for medical costs and lost wages, that was in the Bronze Age. Psalm 41, the Lord strengthens him who considers the poor. And then the Gospels, where the guy whose name you post in your profile healed all manner of sickness and disease among the people. Matthew 4, Matthew 9, Luke 9, healed them that had need of healing. That's quite a coverage standard upgrade. There were the 10 lepers in Luke 17, heals all 10. 9 of them don't even come back to say thanks. 9 out of 10, no gratitude. No copay. He healed him anyway. In Matthew 25, where the whole final accounting comes down to one line, I was sick and you visited me. And Desmond, before you write all that off as ancient history, people have been trying to build a system out of it for 400 years. England taxed every parish in 1601 to care for the sick poor. Nobody called it socialism, they called it the law. Germany made health insurance compulsory in 1883, and the man who signed it then, Otto von Bismarck, a Prussian aristocrat who was not trying to start a revolution, he was trying to stop one. Both of them were building on hospitals the church put up first. The Hotel Dieu, the hostel of God. Because that's who they thought was staying there. I was sick, and you visited me. So the golden rule, do unto others as you would have them do unto you. Desmond, I'm going to ask you the only version of this question that matters, not the abstract philosophy question or the obscure historical exploration. If it's you, or your wife, or your kid, and the diagnosis is the bad one, and the letter comes back denied, what would you have us do with you? Walk on by, or do something about it? I don't know the answer to the government part. That's a genuinely hard question, and anybody who tells you it's easy is probably selling you something. But you asked when healthcare became a human right. 1944, 46, 48. The idea is a lot older than that. From the sound of it, you probably already own the book. That's our show. Until next time, we're off the record.